Well, happy Wednesday, everyone. Hope you're having a great Wednesday. The sun is shining here in Bismarck and the temperatures are rising, so there is a kind of a fresh pep in everyone's step, which is good to see. I want to just go over something, a very important concept, very quickly, but this is the concept of the endothelium. The endothelium is a thin layer of cells that lines every blood vessel in your body. Now, it's interesting to note that we have over 60,000 miles of arteries and veins. And every single one of those miles of arteries and veins has a single cell layer that is responsible for producing a chemical called nitric oxide. Nitric oxide is produced by healthy endothelium. Now, the reason this is so important is this is the underlying reason for every single cardiovascular disease process. Whether you have high blood pressure, high cholesterol, congestive heart failure, atherosclerosis, the, the etiology, the underlying pathogenesis of all cardiovascular disease is this dysfunction in this very important cell structure called the endothelium. And why it's so important is this endothelium releases a component called nitric oxide. And what that nitric oxide does is it creates vasodilation. It takes a small vessel that has a very small lumen and it will dilate it. So now I can get more blood flow going through the artery, and it can better service the end organ, the tissues, and it improves blood flow. Another thing it does, it prevents platelets from sticking. When platelets start to stick, then they can begin to accumulate in the lining of the artery or in the lumen of the artery, and they can create now a blocking. Nitric oxide helps prevent those things from happening, and that nitric oxide is being produced by your endothelium. So you want to take care of your endothelium. Now, you can improve nitric oxide in your body with a number of different ways. You can exercise, and it doesn't have to be an aggressive exercise. It can be just a 10-minute brisk walk can increase nitric oxide. You want to eat your greens, and most people are not eating enough greens. Greens are rich in nitrates, especially the beets and spinach and arugula, and then that will help convert into nitric oxide in the body. Sunlight exposure can actually increase nitric oxide, so getting some sun on your skin and breathing through your nose. And finally, you can use some key supplements. Let me go back to this eating greens for a moment. One of the things that disrupts nitric oxide, because there are nitrates in our saliva in our mouth due to the bacteria that are in our mouth, the oral microbiome, which should be healthy. You could actually negatively impact nitric oxide by using things like mouthwash. So we want people to avoid the like Listerines and Scope mouthwashes. These are things that will actually kill off good bacteria, which will decrease the amount of nitrates being produced that can convert to nitric oxide from the good bacteria in the mouth. Now, you can measure your nitric oxide and your nitrates with a simple salivary strip. What you do first thing in the morning before you have brushed your teeth or had anything in the mouth, you put a pool of saliva on the tip of your tongue as demonstrated here. Then what you do is you just take the two halves of the strip, you fold it in half, and you compress them for 10 seconds. And then you can compare it on this chart. And this is a nice strip because it'll tell you what is your prebiotic diet look like. That's your leafy greens and good bacteria, the oral microbiome, and what your nitric oxide was being produced in the body into nitric oxide. And if you're deficient, this is going to place you at risk of cardiovascular disease, dementia, vascular dementia, things that we don't want to have happen. So I mentioned supplements as one of the things that you can use to help raise nitric oxide. My two favorite are the Vasconox and the Nitric Boost. You don't necessarily need both. I will start patients on Vasconox at 2 capsules in the morning. I'll have them test their strips, and if we do that and we see that improve and normalize things in 30 days, then that's fine. If they're still facing challenges, then I'll have them add an afternoon or a mid-afternoon dose of the Nitric Boost. I have some patients who are doing well with just a Nitric Boost. So I always tell people, test, don't guess. Get yourself some strips. Try the Vasconox or the Nitric Boost, or you can use them in combination. If you have any questions about endothelium health or how to use these supplements or how to get these supplements, please feel free to let me know, and I can make sure that you have the information to benefit from that. But today, while it's sunny, get out, get a little bit of sunshine, practice some nasal breathing, try not to be a mouth breather, and get a little bit of a brisk walk in and eat those greens and work on your heart health. So hope you have a great day. Thanks for your time. Take care.